Natalie Lucas. Just try and keep that rhythm. Get into a rhythm. Yeah, that's it. Slightly quicker.
Noticed that my breathing became very laboured. Got to the point where I was quite short of breath just at rest, and my heart was working really hard.
For those with long COVID, it's an uphill battle.
No faster than that.
For 3 months now, Natalie Lucas has struggled to shake off the symptoms. A once sporty and active doctor by profession, the 42-year-old is a changed person.
Slowly now.
I'm a shadow of my normal self. Everyone who knows me, I'm very physically active, mum of 3 kids.
And relax.
My symptoms currently are still shortness of breath on exertion, and that can be mild, or if I talk a lot, I find actually it gets hard to breathe.
We just need to keep that in for another 1.5 minutes.
There are a few dedicated long COVID clinics in Australia, like this one at St Vincent's Hospital in Sydney. Natalie is among the lucky patients to get in, and today she's having her lungs tested.
You feel nausea?
No.
The demand has been amazingly high, you would say. These people had nowhere to go locally. And so we've sort of been dealing with the local need as well as the expanded need.
My oxygen went to a level that it has been doing when I was walking, no worse, and I pushed myself as hard as I could.
How did today compare to what you used to be like?
Oh, that would have been a walk in the park for me. Yes, I feel like I don't know, they're just a very unfit version of myself.
More than 8.5 million Australians have now had COVID. While it's not known how many will have long COVID, the World Health Organisation estimates that 10 to 20% of cases will be.
We've seen patients that have got symptoms for 6 months, 12 months, and some even for 2 years. But this is a new condition and it's a new virus, so we don't have long-term data.
COVID hit 52-year-old Belinda Fraser hard back in February.
Archie! Arch! After I tested positive, I woke up and it was like someone had got this really tight band around my chest and it had just squeezed in. I found myself struggling to breathe, so my principal and my colleagues called an ambulance.
Belinda realised she might have long COVID when the symptoms didn't go away.
You don't sort of wake up thinking, yay, I'm going to seize the day. It's like, all right, okay, what can I get done today? You're waking up with different levels of breathlessness and you just don't quite know how you're going to feel, because it's definitely this roller coaster. Some days and weeks are good and you think, oh, I'm on the up. And then all of a sudden you'll come crashing back down.
Even sitting here with me now, how does it feel like talking?
Well, I like talking, and it makes me more breathless. So I just find I could talk and then I'm gasping a little bit and finding the words are a bit harder to come.
Walking up the hill near her home is now twice as challenging.
The body just feels so heavy and it just says, I've got nothing left.
Long COVID's broad range of symptoms presents a puzzle to scientists, and because there's no cure, doctors can only manage the symptoms with pre-existing treatments.
Those symptoms, there's over 100 of them. So it's a real eclectic mix of symptoms. Commonly, fatigue is really common, lethargy, breathlessness, brain fog.
For Belinda, treatment at St Vincent's has involved everything from physiotherapy and breathing exercises to Tai Chi. For Natalie, it's a common anti-inflammatory medication.
I don't think we can cure long COVID, but we can manage symptoms and we can manage some underlying associated problems with long COVID, and we're gaining a better understanding about specific treatments for long COVID, but it's very much still a watch this space, more evidence needed, more research needed to treat this condition.
Hello, I'm
I'm good, thank you. That's good. Can I grab a list for today's round, please?
You sure can. There's your list. Thank you.
At Nepean Hospital in Sydney's Outer West, Dr Sharon Wong has been treating long COVID patients over the past 6 months.
Nepean Hospital saw some of the largest numbers of hospital admissions with especially the Delta variant of COVID. Take a seat. Lovely to see you again.
Data from Nepean provided exclusively to 7:30 shows who is most affected by long COVID. Of the 88 patients at the hospital's post-COVID clinic, the majority are women, most in their 40s and 50s.
They're sitting in that slightly younger age group of 40s or 50s, so they're not just your elderly patients with a background of chronic disease.
Mum, there's a new bully today.
41-year-old Donna Pritchard has had long COVID for 6 months, and like Natalie and Belinda, she fits the profile.
Home life, it's definitely affected. I have 4 young children. Things like changing beds, trying to do their dinner, trying to keep on top of their washing, things like that I have to spread out throughout the week.
About a third of all patients said long COVID had affected their ability to do everyday household tasks, and about a quarter said they had to cut work hours or stop altogether.
I have only just recently started working, but I do find I'm a lot more tired after work because I'm on my feet a lot of the day.
And while clinics are popping up around Australia, doctors say more funding will be needed as cases of long COVID grow.
If long COVID isn't managed well, then I think what we're potentially facing is a lot of chronic disability out there. So if we can't intervene and meet the needs of our patients early on to get them back to their former levels of function, then, you know, I think this could be a very large problem.
A little play on the park?
As Donna, Belinda and Natalie try different therapies, the good news is most patients will improve over time.
Maybe this is just how I am now. But I try and think, well, I could think like that, or I'll give it a stab. I'll give it a go.
No one's got a hard and fast answer. I just have to appreciate, I think, that it's going to take time.